Hi, everyone. My name is Consuelo Luna. My partner's name is Lixia Dang. You will be seeing her shortly. We have decided to do viral conjunctivitis. I'm going to be talking about the introduction to the disease and the causative agent. So, what is viral conjunctivitis? Viral conjunctivitis is an infection or inflammation of the conjunctiva of the eye. The conjunctiva is the outermost layer of the eye that covers the sclera. It's a clear membrane, so it's very hard to see. Viral conjunctivitis is also called pink eye. Pink eye is usually associated with other infections. So let's say someone has an upper respiratory tract infection or an eye infection, it is more likely that you will be getting pink eye or viral conjunctivitis if you are near the person. Now, what causes viral conjunctivitis? Viral conjunctivitis is caused by adenoviruses. Adenoviruses cause about 90% of viral conjunctivitis cases. Adenoviruses come from the Adenoviridae family, and they are non-enveloped double-stranded DNA viruses. It is a direct contact with the virus or airborne transmission where it can cause viral conjunctivitis in others.
For the transmission, viral conjunctivitis mainly affect humans, and the people at highest risk are children, old adults with weak immunity, and healthcare workers, especially eye doctors. It is extremely contagious. The virus spreads through direct contact with eye secretions, respiratory droplets, shared items like towels or cosmetics, and contaminated surfaces or swimming pools. Patients are usually contagious for about 10 to 14 days. For the epidemiology, from a public health perspective, outbreaks spread quickly in schools, daycares, and healthcare settings. During COVID-19, about 1 to 6% of infected people developed eye symptoms. So viral conjunctivitis become more common. Prevention focuses on good hygiene, frequent hand washing, avoiding touching the eyes, not sharing eye products, disinfecting surfaces, and using contact precautions when caring for infected patients.
Adenoviruses are icosahedral capsids that are 70 to 90 nanometers, really depending on the size. They are, again, a non-enveloped double-stranded DNA virus, and they actually have different HADV serotypes from different antigens on the surface. So what this means is the adenovirus has antigens on its surface which cause different types of infections. So one can cause viral conjunctivitis, another one can cause something more serious, another one can cause an upper respiratory infection in children. It really depends on the antigens. The virulence factors for viral conjunctivitis are adenovirus pentin-based proteins that can cause cell detachment and rupture. There are E1A and E1B proteins that prevent apoptosis, which prolongs the replication time. By prolonging the replication time, the virus can then replicate for several weeks. And this is prone to reoccurrence. It's possible that if you've had pink eye once, or if you had some sort of infection, then it's possible you can get it again.
For the symptoms, viral conjunctivitis usually causes watering discharge eye redness, itching, and a gritty or burning sensation. Patients may also have tearing, mild eyelids swelling, light sensitivity, and tendon preural lymphonodes. No, lymphonodes. For the for the symptom for the symptoms, viral conjunctivitis usually causes watering discharge, eye redness. For the symptoms, viral conjunctivitis usually causes watering discharge, eye redness, itching, and a gritty or burning sensation. Patients may also have tearing, mild eyelids swelling, light sensitivity, and tendon preauricular lymph nodes. Most cases clear in 1 to 3 weeks, although more severe forms can last longer. For the pathophysiology, following a predictable timeline. Early on, the virus attaches to conjunctival cells and begins replication. Over the next few days, the immune response causes redness, tearing, and the formation of follicles. Adenovirus can damage cells directly and delay cell death, allowing the infection to persist. Herpes simplex virus can establish latency in nerve tissue and evade the immune system, which explains why symptoms may recur. For the diagnosis of viral conjunctivitis is usually clinical, based on watering discharge, follicles, and preauricular lymph nodes, tenderness. When confirmation is needed, PCR is the most accurate test, and adenoplus rapid test can identify adenovirus with minutes. Routine cultures are rarely used because they took too long. Treatment is mainly supportive. Patients are advised to use artificial tears, apply cold compresses, and stop wearing contact lenses. Pseudomembranes should be removed if present. Topical steroids may be used only in severe cases and must be supervised by a doctor. If infection is caused by herpes simplex virus, antivirus therapy is required. Antibiotics are not helpful for viral conjunctivitis and should be avoided to prevent resistance.
Prevention and clinical relevance. Prevention is slightly hard as it is an infection that can be widespread or spread easily. The best thing you can do is frequent hand washing. You want to avoid rubbing your eyes as that is cross-contamination and that will easily infect and cause viral conjunctivitis. You do not want to share towels, linen, or cosmetics as that is also cross-contamination. You want to regularly disinfect public facilities, touch points. You want to disinfect touch points. So doorknobs, handles, anything that gets touched with their hands very easily. That's something that not a lot of people think about, but there are plenty of touch points that can be easily disinfected at home, in a clinical facility, in a hospital, anywhere really. Healthcare workers must take extra precaution as they are near a lot of infections sometimes, especially upper respiratory infections and eye infections. We want to make sure we wear gloves, again, wash our hands, and just try to prevent as much as possible from spreading. The clinical relevance, COVID-19 has increased cases of viral conjunctivitis. 1 to 6% of patients develop an eye issue. Contact isolation is necessary in a clinical setting. You do not want someone that is infected with viral conjunctivitis to be around others if they are not maintaining the contamination or the infection. Patients should reduce sharing objects for eye and discontinue contact lenses, as that can keep the infection in the eye and prolong the infection. An appointment with an ophthalmologist may be necessary if corneal pain is present or vision loss occurs. These are our references. Thank you so much.